Morning, Madam Chair. Committee, thank you. I'm Chip Baggett. I'm Senior Vice President, Associate General Counsel for the North Carolina Medical Society. And we applaud the effort to continue to look at how we provide whole person care. That is something that has been a main goal for us for 6 years, as Senator Heiss pointed out, on looking at Medicaid reform. We think that's an important step that you continue to debate. But I would draw a bright line for you on 3 pages or 4 pages in this bill from page 7 to page 10 that really go back and start to rewrite the agreements that we passed in the 2015 session law on Medicaid reform. The first point that I would point out to you is the top of page 9. It's been brought up. It's where we eliminate the Chapter 58. Those are the insurance law protections. Those are the pieces of state statute that protect both the recipient and the providers that are providing care within the healthcare system. And while we agree that the federal rule that has been adopted does provide some of those protections, we don't think that the state of North Carolina and the citizens of North Carolina should have to rely upon federal law and the federal court system to get remedies to their problems when other folks that have commercial insurance can use state law and state courts to gain those same remedies. We'd like to see commercial entities in the Medicaid system have to behave the same as commercial entities in the private system, and we discussed that and settled that over many years of debate. We'd like that part stricken. The second piece that I will point out to you is on page 10. It is subsection 7A of section 5 of this bill, and it's regarding the 90% threshold that you've talked about extensively during the debate today. We think this is absolutely terrible. This puts all of the burden on the provider to accept a bad contract because there is no definition of what an offering would be here. It says merely that the plan is required to offer a contract, not a value-driven contract, not a good contract, not a fair contract. It could be 10% of Medicaid and still be applicable to the words that are on the paper here. And if not, if they don't accept that, they are automatically included in the network. So this is not about building the network out. They're automatically included because of this language, and they're going to be paid 90%, which is less than what they're being paid now to cover the same care that they are providing now that doesn't cover their current charges. So we'd like to see that stricken or changed before this bill is adopted, and we have some ideas and would love to continue that conversation. And as always, we appreciate the opportunity to speak before you and continue to work with you on making this work. Have a good day.
Thank you. Next.